Hello, everyone, and thank you for joining us. My name is Jennifer Larson, and I'm the training coordinator for the Office of Community Living. Just a few housekeeping reminders. We are recording today's meeting, and we'll post that recording in the coming days on our website. We will be using the Q&A panel to manage questions, so please click on the Q&A button at the bottom of your screen to type those in as you have them. The chat we are only going to be using to share links with you, so we will not be responding to any questions there. A copy of today's slides are available on our website, and we'll drop a link to those in the chat for you so that you can click and download them. And Zoom does provide closed captioning. If you click on the live transcript or CC button at the bottom of your screen, you can turn that either on or off. And with that, I will turn it over to Haley to start the presentation.
Good afternoon, everyone. Thank you so much for joining us today. Jen, if you can move to the next slide. Thank you. As a reminder, today we are focusing on the American Rescue Plan Act Home and Community-Based Services activities that we have been undertaking for the past, oh my gosh, year and a half or more. We have lots of updates as usual and are thrilled to have so many people joining us to hear about those. We'll start by giving you some general ARPA updates, some updates around spending and some of our activities that we've been focused on recently. Then we're going to spend the majority of our time together today talking about strengthening case management redesign. That obviously has been a major focus of the department and specifically the Office of Community Living. And we have a number of ARPA related projects that have been helping to support this effort and strengthen what's happening there. And so we'll have some staff as well as some guest speakers here to talk through and provide updates on what's been going on there. As many of you know, we have a number of grant projects and grant programs currently underway, as well as some that are actively taking applications. So we wanted to provide some updates around our grant programs. We are always encouraging providers, community-based organizations, and individuals to stay updated with our grant programs and submit those applications so that we can continue to get these ARPA funds out into the community. So we have several staff and some guest speakers that will be talking about those grant opportunities and really encouraging ongoing participation there. And then we'll fill you in with a couple of other updates before we close out for the day. Again, as Jen said, we really do encourage you to ask questions as we move through our conversation today. We will have some opportunities for you to come off mute and ask your questions live or to join in on the discussion, or you can use that question box and submit them, and we'll be sure to have the appropriate staff answer those for you. All right, next slide, please. All right, I'm going to keep us rolling and just give a couple of updates around what we've been doing more broadly around ARPA HCBS. Next slide. We wanted to be sure that everybody knew that our most recent quarterly reports are now available and up on the website. So every quarter we submit reports to both the Joint Budget Committee and to our federal partners at CMS on the status of our projects and on all of our spending to date. So there are 2 reports that you can find on the website, as well as a detailed budget and spending report. That is just a massive Excel spreadsheet that really breaks down every project and all of the funds that have been budgeted for that project, that have been spent, and that are forecasted to be spent in the coming quarters. So if you are wanting to get into the nitty-gritty details of either our spending plan or on particular projects, you're looking to find out more and understand what's been happening and the details around those projects, these reports are really a great resource for that. I think the JBC report might be over 100 pages, so there's a lot of information in there, but you can easily navigate and go to the projects that you may be most interested in and not only see a project description, but also review an update on what the project team has been working on over the last quarter. So it's a great resource. So those are up on our website again, and you can find these links in the PowerPoint, or I'm sure we can add those into the chat for you if you want to directly. Next slide, please. All right, so we wanted to provide a little bit of update for you on some of our numbers. So where are we in terms of moving this work forward? So as a reminder, our ARPA HCBS end date is December 31st, 2024. That is a little bit different than some other states. CMS did allow states to spend through March of 2025. We have decided to really try to get these done sooner than later. We made a commitment to getting that funding out as quickly as possible. So our end date is that December 31st, 2024 day. We have 63 projects. So that's all of the work that we have going on across the department. It really does span all of our offices within HCPF. Lots of activities under each of those 63 projects. Included in those, we have 25 grant, pilot, and community initiatives. And those have a budget of approximately $150 million. So lots of funding, again, that's really being pushed out into the community. As you know, in the Office of Community Living, we take our stakeholder engagement really seriously. We've continued to stay true to that through our ARPA efforts. We have engaged over 8,300 stakeholders in either these webinars or our project-specific meetings since we began this work. And we also have a very robust web page. That's why we always are sort of directing people to it, because it has tons of information and we're constantly updating it. It's really meant to be our one source of truth where everyone can go and find out about the projects, get status updates. So we're really excited to see that that's been successful. We've had almost 67,000 page views on our ARPA webpage. So I love seeing that people are using that, and really encourage you to continue to bookmark that and use that frequently. And next slide, I'll move us over into talking a little bit about our spending to date. It's always the big question, where are we in getting this $552 million out the door? So to date, this is through June, so not to date, through June of 2023, we have spent $263 million of that $552 million. So we're nearly halfway there in terms of our spending, and are really thrilled to see that the spending's really ramped up in the first half of this year. So I think a lot of that has to do with our grant programs starting to really kick off and move into implementation. You can see we've still got a ways to go, $292 million that is still budgeted and that we are working to get out the door quickly, and fully intend to spend all of those funds by that December 2024 deadline. All right, next slide. I am going to pause. So those were just sort of the initial, quick overview of where we are on ARPA. Wanted to make sure that everyone kind of had that, had that information before we dive into one of our category areas. And so I will pause and see if anyone has any questions. You can raise your hand and you can come off of mute and ask your question live, or you can use the Q&A function and put your question into the question box. I'll pause for a second and see if anyone has any questions. All right, I'm not hearing any, so I'm going to keep us moving. Next slide, please, Jen.
Haley, it looks like we do have one person with a hand raised, right?
Oh, I'm sorry, I missed that.
Maybe she unintentionally raised her hand.
If you have your hand raised, you're welcome to come off mute and ask your question. Sorry for missing you.
I think we're okay.
Okay, great. Thanks, Jen. Okay, so like I mentioned, today we are focusing on our project category area, strengthening case management redesign. As you can see, we have a number of different projects underneath this work. So I am thrilled to hand it over to Tiffany, who it looks like she is on. Great, Tiffany, I'm going to hand it over to you, and she is going to take over from here and walk us through some updates around our case management redesign.
Great, thanks, Haley. Good afternoon, everyone. My name is Tiffany Domikos. I'm the Case Management Redesign Policy Advisor. And like Haley said, I'm going to be talking a little bit about case management redesign and how ARPA funding has supported those efforts in the last year or so. So next slide, please. So I'll do a little bit of background first for anyone who needs it or is interested. So this slide really demonstrates how kind of our policy requirements for case management redesign have come together and are being implemented today. So we started out with those key outcomes on the left-hand side. So first, we wanted to develop a case management system that follows all federal requirements to ensure financial solvency, which also includes conflict-free case management. Second, we wanted to develop a system that is rooted in quality with an emphasis on measurable performance and outcomes, and continue a partnership between HCBS case management agencies and members and stakeholders to work on that continuous quality improvement over time. The next key outcome that we have is that we want a case management system that is simple, that is easy to access, it's efficient, and provides members with the tools they need to navigate system processes and benefits with ease. Last, and well, I guess not last, stability is our next one. And this is creating a system that is consistent. It's a reliable place that people can get their needs met for long-term services and supports, and all the programs that they qualify for in one place, no matter what their disability is. So no more changing between agencies based on the program that someone qualifies for. They'll be able to go to one place. And then last is accountability. So creating a system that values transparency and its responsibility to its members and stakeholders to deliver the support that is needed in the manner that is expected. That goes along with our quality and simplicity. So all of these kind of converge together. In order to achieve these outcomes, we've had to create a policy framework to support those. So there were a variety of policies that were created. I will highlight 4 of the major ones that are kind of the big umbrellas that really impacted and changed the current system. So first was the new structure. So new structure of case management agencies was that we would have one agency serving people with all types of disabilities for a specific geographic region. Second was knowledge. So providing training and support for agencies to serve all members and to serve all members with that local knowledge and expertise of the community that they live in. Next was conflict-free. So we needed to have a case management system and delivery option that was done by separate entities unless we have a rural exception that is granted. This goes back to our key outcome of federal compliance and keeps us in line with the federal requirements so that we can maintain our funding for the programs that we are administering. And then last is accountability. Again, you'll see that throughout this, but ensuring that there is consistent quality case management and have some sort of accountability measures that are public facing that people can access and understand really easily. So within that, there was also created a framework for new assessment tools, new person-centered support plans, new IT system. So really digging into that, the new assessment tool is now norm referenced and standardized for all members. And then there will be a new person-centered budget algorithm that will have individualized budgets based on a person's needs. And then last is the new IT system. So the care and case management system is being launched right now. Case managers are learning a brand new IT system to really support the foundation of case management and making sure that all of the pieces that need to fit together for good case management are supported in an IT system that speaks to each other, that has interoperability. Next slide, please. So the first step in getting to case management redesign was creating service areas. So like I said before, in the future of case management, a single case management agency will serve all people with disabilities within their contracted defined service area. So this is a change because today, as you can see from these maps, we have 44 defined service areas where we have 24 single entry points and 20 community center boards that provide case management services. We also have private case management agencies that serve across the state. And again, as you can see in these maps, none of this really overlaps neatly. So next slide, please. So new defined service areas needed to be developed. And in order to do that, we had to consolidate. So we gathered information from stakeholders to inform those final decisions of what the future areas would be. We looked at geographic barriers. So things like mountain ranges, travel routes, total size of the geographic region. We also looked at economies of scale. So the department really evaluated the minimum number of members within a certain area that would best ensure financial viability of a case management agency. And then we looked at population density. So HCBS really evaluated the total concentration of members within a specific area to make sure, again, that we could maintain quality for that particular area. To further inform this work, we hired a contractor to provide recommendations on alternative areas and incorporate all of the feedback that we got from stakeholders through listening sessions and surveys. So the map shows the new case management agency defined service areas. These will be fully in effect July 1st, 2024. We have estimated future populations that will include portability within defined service areas. So what that means is that people can move around within their service area and even outside of their service area and continue to maintain their services. We're anticipating new enrollments and changes in counties associated with CCB changes, community center board changes, or single entry point changes. The way that the system will be set up is that members will be assigned to the service areas in which they reside, but they'll also have an option during these transitions in the next year, but also throughout case management services to request to be served by a different agency. So while the CMA, the case management agency, might be changing for some people, it won't be changing for all people. And so there are some really important things I want to highlight that will not change. So first, member access to services will not change. We're not changing anything about eligibility or that access to service throughout the transition or in the new world of case management. The other thing that's not going to be changing is having a person-centered approach in case management services. So the department continues to value that and is really looking to implement that even further in this new world of case management. And case management will also still be a required part of home and community-based services. But these new service areas for case management agencies allow us to really hone in on support that case management agencies need to improve quality and to really maintain the local knowledge and expertise to better support members in those areas. Next slide, please. So then after the defined service areas were created, we needed to go through a procurement process to determine the case management agency for each area. So a request for proposal was released in December of 2022 for providers in newly defined service areas. By July 21st, 2023, all 20 areas had a provider who was notified of a healthcare policy and financing intent to award. What that means is that healthcare policy and financing sent them a letter that said, we have accepted your proposal and we intend to award you this contract. We received a total of 15 agencies getting those intent to award across 20 defined service areas. I will mention here and throughout this discussion about defined service area providers that these specific agencies are subject to change based on protest outcomes. Next slide, please. So this slide and the next slide are the defined service area, the agency that has received the intent to award. And I do really want to be clear that these are the intent to award agencies that have been identified, and the counties that they've served or that they will serve. Many of these agencies are currently serving in the areas where they have received an intent to award. And again, that was on purpose. We wanted to maintain that local knowledge and expertise. So these are in alphabetical order. I won't go through those, but I think this will be available on our website for you to view. At the end of my portion of the presentation, there's also a link to a map on the member-facing website that you'll be able to filter and see who's going where and when, hopefully. So these are the first handful. Next slide are the next ones. And then if we go one more slide, I wanted to spend some time here because I know that some of this transition can bring up a lot of anxiety for folks in the community. So we want to be really transparent about what that transition process looks like. And then after this, I'm going to talk about the support that has been provided and is continuing to be provided to case management agencies through ARPA. So thanks for hanging with me with all of the behind the scenes and lead up to that. So we have transitions happening right now. We have already started those transitions. This list of agencies in phase 1 are already meeting with healthcare policy and financing staff to transition their people and their contracts. We are working on member communication directly from healthcare policy and financing, and then agencies are working on direct member communication from them to keep members up to date about all the pieces. So this first phase will go from August 1st to October 31st of 2023. And they will have contract start dates of November 1st, 2023. The second phase will go from November 1st to February 29th, 2024. And contract start dates for March 1st, 2024. And then the last is March 1st to June 30th, 2024. And with contract start dates July 1st, 2024. Next slide, please. So ARPA funding, what does all this mean for ARPA? So as you can imagine, this is a huge lift. It has taken a lot of work behind the scenes. It has taken a lot of people really supporting case management agencies, supporting the stakeholder process to make sure that we really get this right. So we have leveraged the ARPA funding to support case management agencies through the transition process. This funding has looked like startup funds for eligible case management agencies. So for any of those agencies that are that have been given an intent to award, there is help with office remodels to accommodate larger staff, things like infrastructure, equipment, technology, other system needs that they might have when thinking about expanding their services from just one population into all 10 waiver populations. We have many agencies taking advantage of this funding and are really excited to see how that gets used across the state. We're also using this funding to help with staff retention and hiring. So we know that it is really important to members and stakeholders to maintain the knowledge that case managers gain in their jobs and for members to not have to start over. It's really important to HCBS to fund those pieces of this puzzle because it is really, really important to members. So this funding for staff retention and hiring bonuses, it is funding to give bonuses to case managers and staff who are supporting case management services and ensuring really that case management agencies have the capacity to serve all the members that whether that's current agencies who will no longer be case management agencies in the future, wanting to keep them through the end of their contract and hopefully have an opportunity to transition them to the new agencies coming in, and those new agencies, maintaining their staff and being able to retain and then hire for additional staff who need to come in at the start of the contract. Next slide, please. So to keep members up to date on all the things related to case management redesign, we created a new webpage with resource materials just for members. These are informational videos about various pieces of the new home and community-based services case management system. There are pieces specifically about home and community-based services. We have things in Spanish and English, and over time, we're really hoping that this will be kind of the one-stop shop for resources for members who are accessing home and community-based services and long-term services and supports. Next slide, please. On that page, you'll also find this new interactive map. So this will be updated as things change with the defined service areas, and you'll be able to filter for your county, for your geographic area, and see who got the intent to award in your region and what their contact information is. We're hoping to be able to update this as the transitions happen to let people know, hey, this case management agency is live in their region, that their transition is complete, etc. So keep your eyes out there. That will also be where we will do as much communication as we can about case management redesign. And I think Max was gonna put that in the chat if I'm not mistaken. And so with that, I will pause for questions. Feel free to raise your hand or use the Q&A function. Okay, not seeing any or hearing anything. So I will keep us moving. Next slide, please. So I wanted to introduce Health Management Associates. Sharon Lewis is the lead on this project. They are one of our ARPA contractors who are helping with case management redesign capacity building. She's going to talk a little bit about the work that they've done. They have been a joy and a wonder to work with. We are very grateful for their support. And Sharon, excited to hear from you today.
Well, thanks, Tiffany, and thank you for inviting us to share a little bit about what we've been doing on capacity building with the case management agencies. Next slide, please. So just to kind of give you a sense of what our task in all of this has been, taking all the complexities that Tiffany just described and supporting the existing 41 case management agencies who are delivering case management across 10 different waivers to navigate this change is really at the heart of the work that we're doing. We are working with those case management agencies to figure out what gaps and needs they have. We started with them before the RFP in assisting around some training and doing some webinars and some engagement in terms of kind of understanding the landscape and beginning to identify those needs. Post transition, we've really been focused on, post RFP, we've been focused on providing coaching and technical assistance for those case management agencies so that they can really focus on change management through this transition and getting ready for what is going to happen next. We've also been supporting various stakeholders through some learning collaboratives, some public webinars, some webinars that have been focused on frontline staff and case managers who are experiencing a lot of this change in their jobs and in the role that they have with working with Coloradans across the state. Next slide, please. So before, just for context, again, in talking about the work that we're doing, we thought it'd be helpful to note what we mean when we talk about change management. When a system or a state is going through the kind of change that Colorado is experiencing in adapting the CMRD, that's a big change, and it takes a lot of intent to do it well and do it right. And good change management really supports that idea of both getting through the change and ensuring that the change is going to stick well, and people feel good about the change by the time everything has been completed. And to do good change management, we've really worked with the case management organizations to think about how they need to give time and attention to explain the change, building on many of the things that Tiffany just talked about, how this is going to benefit people, and as well as give the state some tools to ensure quality, ensuring that we're really paying attention and giving time to how the change will happen and how it affects people, and really the human side of the change, supporting people in the change, even when sometimes they may not agree with or want the change, and working with both those cheerleaders and those folks who are resistant, and then really understanding whether change is happening for people in terms of their feelings about the change and how the change is going for everyone on the ground. Next slide, please. So when you think about change management, there's really two aspects of this. One is around what is changing, and in this case, it's the organizations and some of the rules and structure. And secondly, the adaptive change. How do people feel about the change? How is it affecting individual providers, people who receive services, the case managers who deliver case management? And our work has really been focused on supporting the organizations to move through that adaptive change, as well as getting them answers on the technical changes. But most of our work has really been focused on the human impact of this change. Next slide, please. So how are we doing this? There have been several activities that HMA has been supporting. We have an extensive team involved in this effort. We have been doing learning collaboratives in several different formats over the course of the past year and a half. That includes some public webinars focused on culture change and really making sure that we're hearing from people who receive services and understanding change management. We've done many targeted sessions for the case management agencies themselves, including both large groups affecting many of the case management organizations, as well as smaller cohorts of peer-based learning where they can collaborate and share their learning across the different organizations. And then we've also run a monthly set of webinars focused on individual case managers, the staff who will really be carrying the weight of this transition as some aspects of their jobs for some people in some parts of the state will change, including, strategies to get through the change, thinking about how to improve their knowledge and strengths during this transition. One of the really important aspects of the work that we've been doing has been coaching. As I mentioned, there are 41 case management agencies who, prior to CMRD, had been delivering case management to folks across the state. And each of those organizations has been provided an opportunity to work with a coach if they choose to. And the coaches are working with organizations on a one-on-one basis and also in groups to collaborate in areas of the state as they move through these changes. And those coaches are helping people navigate both that technical change, the operational change, and the things that need to be done in order to structurally change, but really also very, very focused on that adaptive change, ensuring that the human capital, the retention of knowledge and relationships is key to this transition, as well as accessing technical assistance and capacity building resources. So the case management organizations have not only had access to the teams that we put together, but they've also been able to seek funding for particular areas of need or gaps that they have related to policy or legal and corporate structures, ensuring that staffing capacity, preparing for the transition, change management, strategic and organizational planning, and communication, and really just getting ready for this change. So the CMAs have had the opportunity to access I don't know if I would call them grants, but essentially funding to purchase support for those various areas of technical assistance and capacity building. Next slide, please. So, what does that mean in terms of the numbers? As I noted, there are 41 CMAs that we've been working with, and each of them has developed, or almost, we have a few more to go, have developed their transition and change management plans, and working with their coaches and some technical assistance to get that done. We are working with the organizations in each of the 20 defined service areas and supporting collaboration across both those outgoing and new case management agencies. We've done a lot of those small group cohorts with the case management organizations, over 35 of them so far. We've been doing those monthly case management sessions that are for the case managers themselves. And those will continue. So if you are a case manager, please join us on those monthly calls. And then so far we've had 15 technical assistance agreements completed with case management organizations, or currently in process, so that they can access those resources. And we anticipate that there will be many more in the coming months as we get closer to the various phases of the contracts rolling out. Next slide, please. And we've just, in terms of, how this has gone, we're very happy. We have heard positive feedback from the case management organizations, from the case managers, from some of the external leaders who have supported the participants' engagement in all of this. And we are grateful for the kind words and the opportunities for us to continue to learn and improve and deliver content and or support that is helpful to people in Colorado as the case management redesign unfolds. So with that, I'm happy to take any questions about the work that we've been doing. And again, grateful for the opportunity to share a little bit about what we've been up to. Next slide. Hearing or seeing no questions, I will turn it back over to, I'm not sure, Max, maybe?
Yeah, thanks,
you very
Sharon. I
much.
think we're turning it over to Haley. Thanks so much, Sharon.
Yeah, thank you so much, Sharon. Thank you, Tiffany. That was a wonderful overview of everything going on with case management redesign. I know it's a lot, but we appreciate you giving us the updates. And we do encourage everyone to visit the website. And there's lots of information there as well for you to follow up and find out more. So appreciate it. All right, next slide, please. So we are now going to move into our grant opportunity highlights. First, we're going to kick it off by giving you an overview of where we are with our grant opportunities thus far. And then we'll move into our open grant opportunities so that you can find out a little bit more about what might be a good fit for you, your organization, or maybe a community-based organization that you work with. So before we jump in, we wanted to launch a poll question here. So you should be able to respond to this. It should pop up on your screen. But we were curious how many people that have joined us today have received one of our ARPA HCBS grants. We, like I said, have really started to ramp up our grant programs. And as you'll see in the next slide, have a number of executed grant agreements now with our grantees. And we wanted to see how many of those grantees have joined us on our webinar today. I'll give you a minute to respond, yes or no. All right, I think that on the back end, we can close that down. And it looks like we have some grantees that have joined us today. Thank you so much. Glad you are here. But also a number of people that are not current grantees. So I'm excited to share some potential opportunities with you about some new grants that maybe you might be able to apply for, might be a good fit. And that's not to say if you're a current grantee doesn't mean you can't apply for another grant for a different project. So thank you again for sharing. It's nice to see who we have with us today. All right, next slide. Okay, like I said, I just wanted to give you a quick overview of where we are in our rollout of our ARPA HCBS grant program. So you can see that we, over the last several months, we've really ramped up our grant programs. You can see back in January of this year, we only had 58 grant agreements in place. And as of or through July, we have 339 grant agreements in place. So are so excited again to have all of these grants and the funding behind them getting out into the community to support our providers, individuals, and our community-based organizations. Thus far, we have about 50% of our total grant funding that has been awarded. And about 13.5 of that has actually been dispersed. So still a lot of money to go out to our grantees and a lot of money to be awarded. So we are well on our way, but have many grant programs still to come. All right, next slide. I'm actually going to hand it over to Heather Johnson to talk a little bit about our training grants. These are an open grant opportunity that have been available for some time, but we're continuing to offer these and look for new individuals or providers that might be interested. Go ahead, Heather.
Thank you, Haley. So I am excited that a few folks are here who have had grants, and hopefully one or more have actually been awarded one of the training grants. So we have an opportunity for training for direct care for the HCBS workforce. We're really looking for the direct care frontline workforce, and the training intention is for higher level skills. Ideally, we're promoting the option to be able to take on more work, additional work, serve more members, maybe serve members at a different capacity. We're also looking for trainings that help the direct care individuals build their own skill set and resume. The training grants, we just opened another cycle August 1st, so it will run August 1st through September 30th. and you can apply anytime within that window. You will know by October 15th if you received an award, and you can start planning after that. The maximum award is $100,000. We will consider any award amount. We've had as little as just under $2,000 for an award all the way up. So no project too small. The eligibility requirements are you have to be a currently enrolled HCBS waiver provider or a training entity planning on delivering that training to an HCBS provider. We do have 4 more cycles to go after this. So if you're not ready now and you're thinking in the future, we are happy to accept your application at any point. We do have an informational webinar on September 6th where you can come. We'll give a little bit overview of the application process and you can ask questions there. These are also recorded and on our website, so you can look at older ones there if that time doesn't work for you. You can view the request for application and the FAQ within that for specific questions you might have. You can also email us and we're happy to help you in that way as well. We just got posted on the website various grants awards that have went out in our first 4 cycles. So I really invite you to look there to see who's been awarded and maybe what their categories are, and that might spark some thoughts about what might work for you or your agency. And do we have the individual grant on here as well, Haley?
I don't.
Well, that's okay. I'll plug it anyway.
Yeah, plug it anyway.
We also have a training grant for individual direct care workers. The maximum award is $500. Again, the same thinking for the training, higher level training that they're interested in taking. And when we say higher level, we mean it can't be that general onboarding annual required training. It has to be something outside of that. I think we're up to maybe 40 awards on our individual grant. We do take those on a rolling basis. So you can apply, give us information, why you want to take it, and you'll know within 15 days whether you received that grant award. And as with both of these grants, once you've closed one out, you can apply for another grant. So these could be used as an opportunity to do maybe a series of trainings that you are interested in. So please check out our website for the individual grant application and share that with folks that you know. The eligibility aspect with the individual grant are working within the HCBS workforce, or you want to work in the HCBS workforce. So we have a couple different options there, and you'll be able to explain that on the application. And again, if you have questions about that, go ahead and email our workforce email, and we're happy to assist you with that. Both of these programs will run through August of 2024. So you have a little bit of time, but we'd encourage you to apply early and often. Thank you. Is this still me? Probably
I think you can go to the next slide, Jen.
Yeah. Sorry about that. Yeah, so you can look here. We've had 2 million in awards, and please check that site out for ideas. Now I'll pass it on. Thank you. Sorry about that.
Thanks, Heather.
Yeah, no worries, Heather. And thank you for punting on the individual grant opportunity. Yeah, and as you can see, there's been a lot of awards already made. So really encouraging, though, there's still funding available. So really encouraging people to apply. So Max, you're up next. You're ready to go.
Great. Thanks, Haley. Hello, everyone. I'm Max Winkler. I'm with the Strategic Outcomes Division here at Office of Community Living, and I am leading 2 ARPA projects under the Emergency Preparedness banner. We're calling these projects Surviving in Place. This is a partnership that we have with the University of Colorado Center for Inclusive Design and Engineering, formerly known as Assistive Technology Partners, for those of you who have been around for a while. We're really excited about these. These are direct benefits to members, specifically geared towards providing them with some safety net in the unfortunate event of an emergency. So it's divided into 2 primary projects. There's the Battery Backup Power Supply Grant and the Emergency Go Kits. The battery backup systems that we are distributing are really, really great devices. You might have seen these. They're used for campers in particular. They're used for backup power in homes. And really the goal of this program is to provide people who use life-sustaining medical devices. So DME like oxygen concentrators or power wheelchairs or CPAP machines or nebulizers, or even a refrigerator that's used to refrigerate medication that needs to be used in order to sustain life, some peace of mind in the event of a power outage. These devices are quite high tech. They are not inexpensive. So this is a really valuable opportunity for people to get a piece of equipment that could be really critical in the case of an emergency. So we have some links. I'm going to drop a link into the chat where the applications can be found. Basically, individuals only need to be active Medicaid members and have some sort of durable medical equipment that falls under this life-sustaining medical devices category. There's lists of examples on that website. And additionally, they have to live in a setting that is not a group home or an assisted living residence, as those facilities already are required to have backup power systems in place for those residents. So please share information about this program. Like I said, it's a great opportunity to get a really nice device that could be really critical in the case of a power outage. The second is the emergency go kits. These are backpacks that are stocked with a lot of really important, maybe sometimes overlooked supplies that people can have in the case of an emergency, and not only a power outage emergency, but also an emergency that requires evacuation, such as a fire, a flood, even a pandemic again. I really hope not, but it has things like dry erase boards, earplugs, masks, gloves, notebooks for communication, medication boxes, playing cards, ponchos, a full list that's been designed by the University of Colorado team who has a lot of experience in this field. And then they can tailor it to individuals who have very specific disabilities, whether that be vision disabilities, hearing disabilities, mobility issues, or communication issues. So these are also available to anybody who's an active member. There is no second tier level of eligibility, such as the backup power grant has. So please do share this information with any members you know that might be interested. The applications are pretty straightforward, and we would love to get as many of these out into the community as possible. They will be ongoing, so there's no deadline for these applications. We will just continue to accept them and distribute as we have supplies before the ARPA timeline comes up at the end of 2024. So I will then pass it along to our next presenter, who I believe is going to be Sierra or Amanda.
Yeah, thanks, Max. Well, hello, everyone. I am super thrilled to be joining you today to share about another exciting ARPA grant opportunity, 606, otherwise known as the Dollars to Digitize Grant Program. We are currently accepting applications for our second round of funding, and the deadline to apply is Thursday, August 31st, so exactly 2 weeks from today. Agencies can apply for an electronic health record or EHR upgrade or new implementation, although we recognize that some agencies might benefit more from a client management system or maybe a paper conversion to a new client management system altogether. Funding also includes telehealth and necessary devices like tablets and laptops. Technical assistance is also provided to help with the implementation process, and other digital transformation projects are included. Please check out our grant program guidelines in the chat for additional information on eligible expenses. We also have some exciting news to share today that due to the high interest in the D2D investments in digital tools and technology, HCBS has increased the grant budget. And as such, the grant award maximum has increased to $350,000 per agency. I also quickly want to share the eligibility criteria to apply for the grant. This includes HCBS and behavioral health providers, as well as the departing or outgoing case management agencies, so those not participating in the case management redesign. However, many of you may know that 606 was also included as one of the 3 grants in the CMA startup grant for the EHR investments for agencies within the case management redesign. Now, if the D2D grant opportunity sounds like it could benefit your agency or an agency you know, we really hope they apply. So please check out the ARPA 606 webpage for details on how to apply using our online application form, and we'll drop that link in the chat as well. And just as a heads up, since this funding increase is so new, we're working on updating the webpage to reflect the new increased amount, but it is $350,000 maximum per agency. And thank you for your time, and we look forward to reviewing your applications. And if anyone has any questions, let us know. Thank you.
Thank you so much, Amanda. This is such an incredible opportunity, and we know we've already had a number of providers that have been awarded grants and are already benefiting from it. So we want to continue to expand that to others in the community. So I'm excited to hand it over to Megan Haynes to talk about the 4.03 grant.
Great, thanks so much, Haley. My name is Megan Haynes, and I'm the Child and Youth Alternative Placement Model Advisor here at HCBS. And I'm really excited to be able to share with you all today a little bit more information on our ARPA 4.03 grant, otherwise known as the Child and Youth Step Down Options Program. For this funding opportunity, we have two tracks, the first of which is the Qualified Residential Treatment Program, or QRTP track. And what we're really seeking to do with this track is give an opportunity to providers to provide us information on some of the barriers to service access or expansion, any gaps that they have identified related to resources or funding, any challenges that they experience in terms of transitions, whether that be step down or discharge, and just really seeking to build our understanding around operations essentially for these providers. The total award amount for this particular track is $2.4 million. So we're really seeking to work with as many of our QRTPs as possible with this one. The other track that we have is the Children's Habilitation Residential Program, or CHIRP track. And this opportunity is designated specifically for CHIRP providers to apply for startup activity funds that would support increased access to services that are not already billable. So a few examples of things that could apply to this funding opportunity would include training and supportive materials, environmental enhancements for facilities, or expansion of existing residential services, among others. This particular track has a total award amount of $1.5 million. And so we'll be seeking to have a few awardees for that particular track. For folks who may have been paying attention to this opportunity for some time or considering it, we wanted to note that the request for applications closes on August 31st. This was an extension from the original deadline, so providing a little additional time for folks to be able to consider applying and submit that application. So we look forward to reviewing applications from folks, hope to see folks taking advantage of these opportunities. And thank you again for the opportunity to talk to you all today about that.
Great, thank you so much, Megan. Also, thank you to Max and Heather and Amanda for joining us today and talking through these grant opportunities. A lot of information, I know, but please visit the website, the grant opportunities page. That's a great spot where you can get all of the information about each of these opportunities and find out all of those upcoming deadlines for submitting the applications and the particular eligibility requirements for each. So looking forward to seeing applications coming in. Next slide, please, Jen. For those grantees that we do have on the call today, and then for those who are maybe future grantees, we wanted to announce a new grantee resource that should be coming out very shortly. So we have developed a new grantee guidance document that will be hopefully a really critical and helpful resource for all of our ARPA HCBS grantees. So we know that for each grant program, you are working with the individual teams and have your grant agreements, which outline your requirements. But there are some, general ARPA HCBS requirements, or even just requirements because this is a state grant that we want to make sure that all of our grantees understand. And so we have put together this document that has everything in one place. It will cover topics such as allowable costs and cost principles, duplication of benefit, time and effort, invoicing, supplanting or supplementing, purchasing equipment or other capital expenses, and grant monitoring and reporting. So I'm hopeful that this will be a really helpful resource for everybody and will be kind of a, you know, an FAQ where you can go and make sure that you understand all of the requirements of you as a grantee. We'll also be hosting a webinar for all of our grantees. That'll be an opportunity where you can come and listen and learn about this new resource and also ask questions. So we didn't want to just send this out. We wanted to give you a chance to actually have some discussion and answer, ask questions about it if you had any. So keep an eye out for that. We hope to release that in the coming weeks, but wanted to just give you a preview that that is on its way. And so we are looking forward to giving you some more resources and making sure that you have what you need to be successful in your grant program. Next slide, please. So I know we only have a couple of current grantees on the call today, but on this topic, we thought we would pause and see if there were any other additional supports or resources that would be helpful to you as a grantee. We're always looking for ways that we can support our grantees, and I know for many, it's the first time they've gotten a grant. And so there can be a lot of hurdles and challenges with sort of navigating what's required and what's needed and the timelines and all of those things. So we're always trying to figure out how we can best support you. So if you are a current grantee, or even if you're not and you're thinking about applying and wondering or thinking about what supports might be available to you, we'd love to hear from you. So I'm going to pause and see if you'd want to come off mute. You're welcome to raise your hand or just come off mute. You can also put a comment in the Q&A for us about any other additional supports or resources that would be helpful for you as a grantee. All right, I'm not seeing any hands or anything in the Q&A at this point. Please do know that we are always open to receiving feedback and getting suggestions. So if you think of something after the webinar, feel free to reach out to your contact, your project contact, and let them know. Again, we're always looking for how we can better support you as a grantee. And if you think of something, please pass it along. All right, so I will go to the next slide. There we go. So wanted to remind everybody that we, in addition to doing these quarterly webinars, which I think are a great opportunity to get updates on where we are and hear about the latest open grant opportunities, we also have our ARPA Project Pulse newsletter, and this comes out more frequently. So this is a monthly newsletter, and again, is a really good way to stay informed about our progress. We typically highlight one or two projects. We often have kind of a partner spotlight where we talk, as we did today with our HMA coaches. We'll have one of our partners come and talk about the work that they're doing. But we also always list out open grant opportunities and stakeholder engagement opportunities. So as you can imagine, across those 63 projects, they're all often hosting different stakeholder engagement meetings or listening sessions, work groups, all sorts of things are underway. And so really encourage you to, if you haven't already, sign up for the Project Pulse newsletter to stay informed. And then you can, look through it and figure out if there are particular projects that you want to jump in and get engaged with. We also always post past issues on the website. So you can go there and take a look at issues that we have sent out in the past and get updated on all of that. and you can subscribe to the newsletter on the website. Our most recent newsletter actually went out today. So if you did not receive a newsletter today, that means you are not currently on our email list. So please jump into this link, which Max, I'm sure, will provide in the chat, and be sure to get subscribed so that you are receiving those on a monthly basis and are staying up to date. Thank you, Max. Okay, next slide, please. Okay, I think we are getting close to the end of our presentation today, but I want to make sure that there's no questions about anything that we've covered throughout the webinar, or any other general questions that you have about ARPA HCBS and what's happening at the department. We want to open it up to see if there's anything that people would like to pose. You're welcome to raise your hand and come off mute, or you can type it in the question and answer box. Okay, I'm not seeing any. So next slide, please. So we are always striving to improve these engagement opportunities, and the way that we can do that is by hearing from you and getting your feedback. So if you can please take 60 seconds, very quick, I think it's even less than that, to take this very brief survey and let us know if this webinar met your needs, or what else you would like to see, how you would like things to change. It's really helpful for us to get that feedback and know exactly what you need so that we can design these webinars in the best way possible. And I believe Max has put that in the chat already, so he is on it. All right, next slide. Before we close, I just wanted to plug our next webinar. So as I said, these are happening on a quarterly basis. So the next one is on Thursday, November 16th. So make sure that is on your calendar. You do have to register. So you can see the registration link here. I'm sure Max will send that up. Already did. That's in the chat. So be sure to register in advance and get that on your calendar so that we can provide another update in a couple of months. All right. Next slide. Thank you so much for joining us today. I know it's hard late in the afternoon, but we really appreciate you being here. And we look forward to seeing you at the next webinar in November. Thank you so much. Have a great day.